The Waikato DHB is rescheduling around 1,300 outpatient appointments and 165 inpatient treatments, so senior doctors can focus on patients in the emergency, intensive care and maternity departments. The Waikato District Health Board is postponing and rescheduling hundreds of outpatient and mental health clinics and non-urgent surgeries due to a nationwide junior doctor strike. The strike will take place from 7 a.m. on Tuesday, January 15th until 7 a.m. on Thursday, January 17th. However, mediation which could potentially avoid the strike was happening on January 9th and 10th. The Waikato Health Board is rescheduling around 1,300 outpatient appointments and 165 inpatient treatments, so that senior doctors, who are not striking, can focus on patients in the emergency, intensive care and maternity departments. All patients whose operations or clinical appointments are affected are being notified by telephone. The board employs around 450 junior doctors, mostly working out of Waikato Hospital. The New Zealand Resident Doctors Association issued a strike notice on December 31st, in a bid to secure the renewal of the National Collective Agreement, which expired last February. Association National President Courtney Brown said most health workers had gained improvements to their terms and conditions of employment in 2018, but health boards had taken a different approach with resident doctors. Resident doctors are a particularly vulnerable workforce due to the mobile nature of their employment, moving regularly and frequently between DHBs as part of their training. Each move they are technically new employees, and without a multi-employer collective agreement, to provide protection to terms and conditions of employment, they are literally at the mercy of different terms and conditions being imposed. Contingency plans are in place to ensure essential and emergency services will not be affected, according to the Health Board's Incident Controller Barb Garbett. Junior doctors are a vital part of the healthcare team at Waikato Hospital, and this strike will affect our ability to carry out services. We will need to reduce the number of patients in the hospital over the period leading up to and during the proposed industrial action. All of New Zealand's 20 DHBs will be affected by the action, which will involve a complete withdrawal of labour by association members. The Waikato District Health Board's other hospitals in Thames, Te Kuiti, Taumarunui and Tokoroa are mostly unaffected. We are reminding the public to keep our emergency department for emergencies only, Garbett said. If your illness or injury is not urgent, you may face long delays. It's better to go to your family doctor or a local private accident and medical clinic when symptoms first appear rather than becoming seriously ill and needing emergency services, but people should not delay seeking medical treatment if they think the matter is urgent. Patients can also contact Helpline for advice on 0800 611 611. Hospital has set up a helpline number 0800 276 216 for those who are unsure about their appointment. Stuff.